Thank you. Let me just share my screen and then we can continue. Okay, good. So first and foremost, I would like to thank First Ghana and the Health Department leaders for extending this invitation to me to present on periodontal disease, or what we commonly know as gum disease. So my goal is that today, by the time that we're done with this presentation, we have an understanding of the following objectives that I have written here. So first, what is periodontal disease? Gum disease as it is associated with our systemic health. And then we'll go more into the different stages of periodontal disease. And then afterwards, we'll talk about the effects. There's many effects, but I've narrowed it down to gum recession and missing teeth. And then we'll end with prevention, which includes how we will perform our oral health care at home and what we can do to prevent ourselves from getting a progressive form of the disease if we're already suffering from it. And then lastly, what we can do to replace missing teeth. So what is periodontal disease? So the word periodontal, it means around the tooth. So periodontal disease have several diseases, but today I want to focus mainly on periodontitis. And that means that inflammation of the structures that are supporting our teeth. And periodontal disease means the structure surrounding your teeth, inflammation that's causing periodontitis. So periodontitis is a very common inflammatory condition. It affects many, many people. Actually, they say that periodontal disease or periodontitis. So it is a very common inflammatory condition, and it affects, like I said, the structures of your, the structures that are supporting your gums and your teeth. So if you see here in this picture, I have a picture that's showing you how your teeth should look like in health. So you have the gum tissue, is very nice and pink, and then you have the bone. The bone structure is nicely supporting the tooth. There's no reduction of it. It is supporting the teeth nicely. The gums are clean and there's nothing going on here. This is what we consider health. But then in disease, you see that there's bacteria that is in this area, as you can see largely in this circle. You see that there's plaque and tartar that is stuck to the tooth. And all that plaque is basically food and just different bacteria that has been there for a very long time. And first, it's plaque when it's very soft, but then when it becomes very hard, that's when they call it calculus or tartar. Many may have heard the word tartar, and that's basically plaque that has gotten very hard. Sometimes when you're brushing your teeth or when you're flossing, you see maybe if it splatters on your bathroom mirror or something, after a while, it'll get very hard. And that's exactly what happens with our teeth with plaque and tartar accumulation. Also, you see now that the gums here are now very red and inflamed, meaning it can easily start bleeding. And then also the bone has reduced compared to the opposite picture. You see that the bone has reduced significantly. So you have a couple of things happening here. You have the bacteria that is causing the inflammation. Your gums are turning pink because your body is trying to combat what's happening with the bacteria there, and then the bone is reducing. But right now, I want to draw your attention to this bacteria. So when the bacteria is inflamed, causing the inflammation, and it has accumulated to the point where your body is trying to fight it so hard, this bacteria is very harmful, and it can actually go through your gums and into your bloodstream, and it can also cause systemic infection. And so that's why there's been a lot of studies that have been done regarding gum disease and systemic health. So many people think, oh, I don't have to worry about my teeth. I brush my teeth every day, so I don't have to worry about my teeth. I need to just focus on whatever conditions I have that I go and see my primary care doctor with. But it's actually far from true, because there's been so many research that has been done that has found associations between gum disease and these systemic conditions, as you can see here in this picture: diabetes, cardiovascular disease, Alzheimer's disease, rheumatic diseases, and respiratory diseases. And what's interesting is that with Alzheimer's disease, there was a study that was done that said that, let's say you are part of the group of people who are age 70 and above, and you've had this gum disease. When you're home, you have bleeding gums, but you're just brushing your teeth. You don't, or maybe you don't brush your teeth, or you're not flossing at all, and you haven't seen a dentist. So now you're in the age group of 70 plus. You have this chronic inflammation that's going on. The study says that you are 70% more likely to get Alzheimer's disease or to also get the dementia. So you're 70 plus, what's it called dental visit, and you haven't done anything about your oral health, you are 70% more likely to get Alzheimer's or dementia. And then if you already have Alzheimer's or dementia, they found that if you do have gum disease, in a 6-month period, they see that you have a significant decline in your condition of the Alzheimer's disease. So I want to talk more about some of the conditions that we are more, most of us may have these conditions, like cardiovascular disease, for example. They found that, I know many of you may have heard the term atherosclerosis, which is basically your blood vessels that have hardened. And that plaque that has hardened in your blood vessel, they found that some of the oral bacteria, some of the bacteria that we have in our mouth when we have gum disease have been also found in that plaque that's in your blood vessel. So basically, you have gum disease, and then you have this atherosclerosis, but you're not taking care of your gum disease at all. And the infection is just increasing and increasing. And now it's going through your gums into your bloodstream. And it's just making that condition that you have, for example, atherosclerosis, is making it even worse by feeding the bacteria in that area. And then, of course, you have constriction of your blood flow and many other things like blood clots. And then these things lead to heart attack and stroke. And it's all because you have a gum disease that you haven't been able to take care of. And then you have this systemic condition, and they're just working hand in hand. But I'm not going to go too much in detail with, cardiovascular conditions, because I'm not a physician. However, when it comes to respiratory diseases, it's the same concept as well. The bacteria that's in your mouth, you can inhale it and into your lungs, and then also cause those inflammation, chronic inflammation conditions like bronchitis and pneumonia. And most importantly, when it comes to periodontal disease, the main condition that there's been so many research that has been done on this is diabetes. Diabetes is one condition that they describe it as a dose-dependent relationship between periodontitis and diabetes complications. And this just simply means that if you have gum disease and you're not controlling the gum disease, and you have diabetes and you're not controlling the diabetes, it affects both and it makes both situations worse. So what the research found as to why there's a association between diabetes and periodontal disease is that when your blood sugars are high, when you have high blood sugar levels that is in your saliva, it feeds the bacteria. One thing that bacteria likes, the partner said, is sugar. And sugar increases, and then it just grows and grows and grows and grows in your mouth. So that's why they recommend brushing your teeth at nighttime, because when you go to sleep, your body, your oral mouth goes into an acidic pH, and all the sugars are now feeding onto the bacteria in your mouth and making things worse. They're basically having a party in your mouth because of the sugar. So now you have a high blood sugar level, you're feeding the bacteria that is causing the gum disease that you already have, and it's making it harder for you to manage. And it works backwards too, as well as if you have diabetes, it's hard for you to control your gum disease. And if you have gum disease, it's hard for you to manage your diabetes, your gum disease, vice versa. And some of the things that diabetes has an effect on is attachment loss. So attachment, like I mentioned before, the periodontal is the structures that are supporting your teeth. So attachment loss, you have bone loss, you easily get bone loss, you easily get your gums to be receded when you have diabetes. Increased probing depths. I'm sure many of you who may have gone to the dental visit, you've gone and they've used an instrument and they've counted numbers, maybe 1, 2, 3, 4, 5, and 6. These numbers help us to understand where you are in your condition. So with these numbers, those who are diabetic, they have higher numbers. A healthy patient may have numbers between 1 to 3, but a diabetic patient, chances are they'll have numbers 5, 6, and 7. That means that conditional, right? And then another point with diabetes is poor wound healing. Diabetics are prone to getting infections, and when they do get infections, it's very hard for them to heal. So with diabetes, those patients, we see that even when we do treatment or care on them, their outcomes are different from those who are healthy patients because they have this poor wound healing. So if you have uncontrolled diabetes, sometimes we don't even perform surgery on these patients until they're able to control their diabetes with, looking at their A1C number. For those of you who are diabetic, you will be familiar with the term A1C. You'll know if your levels are controlled or not. And if we're seeing numbers that are like 9, 8, those high numbers, we won't perform surgery because the outcomes won't be as good as we would want us to see if we were to see on a patient who may be healthy. So end all be all when it comes to gum disease and systemic health, especially diabetes, you control your blood sugar, you lower your risk of getting diabetes, or you lower the risk of your diabetes getting worse. So let's get into more of periodontal disease and the different stages that we have. So earlier I mentioned the instrument where we use to determine the stage you are in your condition is this instrument here that is nicely pictured. We see the different black lines here show what number. So 1 to 3 are numbers that are good. But then when you're getting more higher, like 5, 6, and 7, that means that your condition is getting worse and needs immediate attention. And I want to emphasize that periodontal disease is an infection. Okay, periodontal disease is an infection. So if you're sitting there, you haven't taken care of your teeth, understand that you have an infection in your mouth that has to be taken care of. Okay, so the first stage, we already discussed how healthy gums look. We know that the gums are pink, the bone is at a nice level. But then we have gingivitis. Many of you have heard the term gingivitis. And all that means is inflammation of your gums. Gingiva is your gums. So when you put the words together, it is inflammation of your gums. And you see here in the picture, at this time, the bone is unaffected. You see just a little bit of bacteria and the gums are red. This stage is completely reversible. So at this stage, ABI will say maybe for 3 days, or ABI, there's some type of plaque or bacteria somewhere that you haven't been able to properly get rid of, right? And so now your body is like, something is wrong. So let me combat it. And it does that by bleeding, right? So your gums now are red. This stage, if you are able to remove whatever is happening there, you'll be able to reverse the condition and everything will be good. Now, when you go on to mild periodontitis, you notice that the bone level has reduced. Your gums are now detaching from your tooth and you see more of the bacteria, and the number that you see in the instrument is also increasing, okay? And so at this stage, it's no longer reversible because reversible because now you have lost bone and your gum tissue now has detached, and then it forms what we call a pocket. So as your gums is removing from your tooth or the roots of your tooth, it forms a pocket in that area, and the bacteria just keeps growing in. And then sometimes when we're eating, it gets impacted or it gets stuck in that area. So how can I say this in Chi? So basically, let's say you've had this inflammation, Unchichi will sit for a few days, and then you haven't gone to the dental office. After your bones is now reducing, and your gums are now bleeding, and at this point we can't go back. We can only try to move forward and try to fix the situation. And as you can see, there's moderate periodontitis and severe periodontitis, where the bone loss has reduced significantly, and now your teeth may be moving. It's not stable in the bone. And in this stage, some people say, oh, metihana, mesinutuya, or menindia, yesi me extracted mesino. And it's because you basically neglected your teeth in this situation, and the bone kept reducing, and now it's no longer able to hold the tooth anymore. So now the tooth is loose and it has come out, or you were told that you need to get an extraction. I hope that and mudaho in terms of the stages of periodontitis. So let's move forward to the effects of periodontal disease and what happens when you're unable to, properly take care of your teeth. So first and foremost, I want to discuss gum recession and missing teeth. The effects of periodontal disease is vast. There's many things that can happen, but the most important or the most common things are gum recession and missing teeth. So if you can see here on the right side, or my right side, you see that the gum tissue is nicely covering the tooth. But then on the left side where it says gum recession, you see that the crowns of the tooth and where the gum is, there's a space. And you see the roots of your teeth, which is the yellow part here. When this happens, you have sensitivity, and it's very uncomfortable. You may drink hot or cold, and then you will have a reaction, or it will feel uncomfortable. So this happens because as a result of periodontal disease, or as a result of poor oral hygiene or plaque accumulation. Your body is fighting off the bacteria that is just building up there, that is moving the gums lower and lower, and then also your bone is also going lower and lower in this case. This is another picture. This is an actual person's teeth and how their teeth has had gum recession. You see how it's turning yellow. In some cases, someone say, oh, Messinaya yellow, how can I bleach it? But it's really the roots of their tooth that are showing. In this area is a different layer that's covering your crown than what is covering your roots. And that layer is more yellow than what's covering your crown. So you see this here, and your teeth appear to be longer. If this is your situation, if you see your teeth and you do have this recession here, all hope isn't necessarily lost, because we do have a treatment for it, where you can get a tissue graft in that area to cover the space that is being seen here, and it will sometimes, depending on how much it has reduced, we can get complete coverage of the root area, or you can get a little bit coverage so that it doesn't look as bad as it did before. And how this procedure works is that we get tissue from the roof of your mouth. We get that tissue there, and then we put it over the gums, and we, suture it or close it together. I did not want to include pictures of that because sometimes the blood and all that makes people feel uncomfortable. So I did not want to show that. But in this picture here, you see how the patient started with the recession. And you can also see in some of the parts where the tooth is very long, you see that they put a material there to kind of help cover it, maybe because the patient was having sensitivity in that area. But still, their tooth looks still too long. So they did the grafting, and as you can see here, they were able to achieve complete coverage of the root area. And so now they no longer have that sensitivity in that area. So let's move on to missing teeth. So in this picture here, this is worst case scenario picture. The gums are completely red. They're bleeding. When we use the instrument in these cases, it immediately starts bleeding. There's a lot of plaque that's built up, and the plaque has gotten to the point where it's so hard that it needs to be removed professionally. So some people say, oh, Debbie, I'm floss it all the time. Why do I need to see the dentist? You know, but when it comes to brushing, there's only so much you can do for a long period of time. After a while, you need to get help. So that's why we recommend you to go to your dental office. For patients who regularly go and have healthy gums, we say every 6 months, they should go to their dentist and get a checkup. But in this case, this patient probably hardly never went, and they presented with this condition. The plaque has built up to the point where it's gotten hard. It has also turned into this black color here. And when it looks like this, sometimes patients don't know because it sort of looks like the color of your teeth, except for the parts that is turning black. The white plaque or tartar that has built up sort of looks like the color of your teeth. So you think, oh, I'm just brushing it, but it's not removing, and you don't know that it's not removing because it's blending in with your color of your teeth. And we call these sheets of calculus, as they are just blending in with your teeth, and they're hard for you to remove on your own. This patient has a lot of cavities that has built up. You can just tell that they've obviously neglected their oral health, and they're now coming for the dentist to rehabilitate them or bring their gums back to health. If your situation is like this, again, all hope isn't lost, but we cannot bring you back to where you were when you were younger, but we can bring you back to a healthy state where your gums won't be bleeding as much, and we'll remove all this here. All this plaque and tartar needs to be removed with a dental instrument. It's not something that you can do at home. I know there's a lot of commercials that show instruments, like metal instruments that you can use to remove plaque and tartar at home. I don't recommend or advise anyone to use those kind of instruments at home, because our teeth and our gums are structured in a way where you won't be able to properly do it on your own. You will need the help of a professional to help you remove it, or else you can cause damage that you don't know, and later on you may find that it's because of that instrument you was using. Those type of instruments, they also can cause recession as well, because you're not aware of where your gums is and where your tooth is ending. So you can cause more damage than not. So it's best that you go see your dentist to help you figure things out. But in a situation like this, you'll go to your dentist and he will refer you to a specialist, which is a periodontist, to help you in this situation. In this situation, first, we'll start with the deep cleaning. Know many of you have heard of deep cleaning, and all that is basically us cleaning beneath your gums. So normally if you go for every 6 months cleaning, we're not cleaning below your gums, we're cleaning above the gums. So everything that you see that is above the gums is what you get cleaned off in a dental visit. But when you have a situation where you have the plaque buildup and the bacteria is causing those pockets in between, like I mentioned before, you need a deep cleaning. And with the deep cleaning, we will remove all the plaque and the tartar that's there, and we'll see how things heal up. You may start with numbers, maybe 5, 6, and 7. And sometimes we hope that after the deep cleaning, we will see numbers that are maybe 4 or less. But sometimes when the numbers are too deep, you require surgical intervention. And probably some of you have heard where they say, oh, I was some surgery, or whatever they said. And it's not them just telling you, oh, go do surgery just because they want to tell you to go do surgery, but it's because with the deep cleaning, we can only go so deep. The instrument can only go at most 5 to 6 millimeters deep below into your gums. So if you have numbers that are 7, 8, those instruments for deep cleaning cannot help in that situation. We will have to do what we call osteosurgery. And osteosurgery, the term osseous means bone. So basically it's surgery for your bone. And at this point, it's because the damage that has been caused by bacteria has been eating away at your bone. You can see in the picture before surgery, on the left side, you see the bone has a nice round structure, but on the right side, you see that the bone has been eaten away by the bacteria and the gum tissue is inflamed. So when we go in for osteosurgery, for the bone surgery, we open the gum tissue so we can see everything clearly, right? And then we remove all the bacteria, the calculus that's built up there. We remove the gum tissue that's inflamed and red and is no longer healthy for you. And then we also reshape the bone. As you can see here in the third picture, we are shaping the bone so it has a nice round structure like it was. We tried to attempt to shape it into a nice round structure like it was before the bone loss occurred. And then that way we put the tissue back, and the tissue now will be at a lowered area. You may find that now you do have some recession, but it's because the goal of this osteosurgery or this bone surgery is to make the area more cleansable for you. So make it in a way where when you are at home, you can clean your teeth on your own. When the gum tissues are high above and they're inflamed and you're trying to clean your teeth at home, you can't. Just like how the instrument cannot go so deep enough, your floss or your brush cannot go so deep enough when you have this type of condition. So when we remove the bone and we remove the soft tissue, now you can clearly see your roots of your teeth, and you can properly brush that area, and so that you can keep it very clean. So that's the goal of this osteosurgery. So if you ever at a dentist office or you go to periodontist by referral from your regular dentist and they say, ma'am, you're gonna need osteosurgery, don't feel like it's anything where it's like, oh, I don't want to do it, it's surgery. You will give local anesthesia, so you'll be numb, you won't feel any significant pain, and at the long run it will just be beneficial for you because your bone will be at a state where it's healthy and we can maintain your teeth where it is, or else the bone will continue reducing and you eventually lose your teeth. So this is just an example of a patient who came with a severe case, a lot of gum inflammation, is bleeding, plaque and tartar is built up on there. And on this patient specifically was also taking medication that caused their gums also to be more puffy or grow more. So in this situation, we removed the gum tissue, we cleaned out everything. And as you can see in the picture towards the right side, you can see how the patient healed up. Now, if this patient continually brushes and flosses, they will be able to maintain their teeth the way it is. So when we do the surgery, it doesn't completely solve everything and then you just go home. You have to make sure to still do your part at home by brushing and flossing your teeth, and in order to maintain your health. And then also being on a maintenance protocol. And that maintenance protocol for these patients are every 3 to 4 months. So if you've ever gotten a deep cleaning, you've ever gone to a dental office and they told you, oh, we did a deep cleaning on you, you should be going to the dentist every 3 to 4 months. I know that insurance may only cover your cleanings twice a year, so for every 6 months. But if you are someone who's had deep cleanings done in the past, you need to be going every 3 to 4 months. So you can alternate insurance now. So make sure that you are able to keep your teeth, because the goal is to maintain your teeth. So there's a term we all know, prevention is better than cure. So how can I prevent myself from having these conditions or losing my teeth completely where I have to go get surgery. So most importantly, you want to be able to clean your teeth twice a day, brushing your teeth and also flossing. And here is a visual of how you should brush your teeth. You want to make sure that first and foremost, you're using a soft toothbrush. If you have a hard or a medium or anything other than soft toothbrush at home, I please beg you to throw it in the garbage tonight, because those toothbrushes do not make things any better. They actually may make things worse. And it's not how hard the toothbrush is that will determine how you're removing the plaque or bacteria, but it's more so your technique. So you want to use a soft toothbrush. The hard toothbrush actually makes things worse by causing gum recession, because that aggressive motion that you're using to brush your teeth is actually chipping away or moving away at your gums. So some may find that they've been brushing their teeth so hard that there's like cracks in their teeth because of how hard that they've been brushing, or their gums have receded only just because they're brushing too hard. So you want to make sure that you're using a very soft toothbrush. So all hard toothbrushes after tonight have to go to the garbage, and we'll be using only soft toothbrushes. So in this picture here, you see that the bristles of the brush are going into the gum line. In the first picture and also in the second picture, you see that they're going into the gum line. And that's the main goal of when you're brushing your teeth. The picture says a 45-degree angle. It may be hard for you to actually visualize that you're doing a 45-degree angle, but the goal is to get the bristles to go at your gum line. So when you're brushing your teeth, it's not only your teeth that you're brushing, it's also your gums that you're brushing. You want to make sure you're removing the plaque and the bacteria that is surrounding your gums. So you make sure the brush goes all the way up there, and you do nice circular motion. And the goal is to focus when you're brushing your teeth. I know some people, they wake up, they're just brushing. You have to take your time. You have to take a total of 2 minutes to brush your teeth. It may seem long, but 2 minutes isn't long for you to maintain your teeth. So you want to split your teeth into 4 sections. You have the right side, the upper and the lower of the right side, and then you have the upper and the lower of the left side, right? And you do one part at a time. So there's 4 parts. Okay, you focus on the inside and then the outside as well. And you do 2 to 3 teeth at a time. You do circular motions and you slowly move forward, and then you move over to the other side. You don't move to the other side unless you've finished the other side. So no more of brushing up this side, and then you're done. You want to do this side slowly. This side. Now I'll move it to this side. That means you don't have to go back to this side anymore. You just, you finish that side and you move on to the next side. And then flossing. So with a floss, I know many may not be comfortable with the string floss because sometimes our hands might be too big, or just the movement or the action that you have to do to angle the floss may be difficult. But if you can, it's the best way to do it. And with that, you wrap the floss around the tooth and you go up and down. So you're basically picking up that bacteria that's in that pocket in between your gums. You're picking it up and out. You don't want to do side to side. That's a no-no. You want to do up and down, okay? And if you're not using the string floss, many are using the floss pick. Those are good as well, but you still want to do the same motion. You don't want to do side to side. You want to do up and down. So just picture you picking up the plaque or the bacteria, or attempting to pick up what you see. Tonight, if anyone has these floss pick at home, go in the mirror in your bathroom and rub that pick against the tooth, right? And see what comes out. You'll notice how much of the plaque that may come out. So you have to rub it against the tooth, pick it up and out. And then just make sure there's 2 sides of your teeth. So you do one side and then you do the other side. And you take your time when you're doing this. And the idea is to floss every night. Every night, if you can floss, that would be ideal. And for those who are perfect, they floss after eating. So after that, and when you get into the habit of flossing all the time, you'll find, say, you have to floss your teeth, or every night you have to floss your teeth because you feel uncomfortable. You can feel, say, and it feels uncomfortable. So after brushing every morning and night, you add floss into your routine. It reduces that bleeding that you may see. People may say, "Oh, Debbie, I'm bleeding," and it's because you're not properly removing that bacteria that's there. So the more you remove that bacteria, you go to your dental appointments and they're able to remove it for you, the parts that have gotten hard that you can remove yourself, you'll see that the bleeding will reduce itself. And then this also adds to with bad mouth odor. The bacteria that's sitting there is what's causing the odor. So maybe you're brushing your teeth all the time, you're flossing, but you still have a bad odor. It's because you're not able to remove that bacteria that is so hard on your teeth. So you need a professional to help you remove it. And then afterwards, when you do your own practices at home and you're keeping up, you'll find that the odor will reduce. And then another thing, for patients who may have reduced gum levels and their bone level is also reduced, floss may not be your best option. You may need to use something like this that I have pictured here, that goes in between the teeth. Because if you see in the first picture, they have the string of floss there, but it's not able to get in between the teeth where the plaque is really touching and adhere to. So when you use that brush, you can actually brush the floss out. So there's different sizes. There's big size, small size. You have to determine which size fits in which area. You may need to use 3 sizes for your mouth. It all depends. But if you go to your dental visit, your dentist, they will be able to tell you what sizes that you need to use, and you'll be able to better efficiently clean those areas, because floss in those areas won't work because the way our teeth are shaped, it's not able, that little floss is not able to actually contact the tooth to remove that plaque and bacteria. So in those patients, you want to use these things, they call it Proxy Brush, and it's in Walmart's, Rite Aid, CVS, anywhere that you can go find things to brush your teeth, mouthwash, toothpaste, those are all there. And I also want to mention, besides the fact that you want to use a soft toothbrush, you want to use a pea size. So the vegetable pea, you want to use that small amount of toothpaste when you're brushing your teeth. And many people always ask, "Oh, what toothpaste should I use?" My personal opinion on that is that it really doesn't matter. It's more about your technique with brushing your teeth. But if you are somebody who have sensitive teeth, then toothpaste like Sensodyne may help with the sensitivity you have. But if you're not suffering from sensitivity, any toothpaste that you feel is comfortable for you, that you've been using for a very long time, is good enough. You just have to make sure you're following those techniques that I mentioned with brushing. And one last thing that I failed to mention when it came to brushing your teeth is that after you've made the bristles angled towards your gum line for your back teeth, when it comes to your front teeth, you want to brush up and out. You don't want to brush side to side because your mouth is round. So if you're brushing like this, then you're not getting in between the teeth. So you want to make sure you're brushing up and out, the same thing on the top, up and out. And that's the best way for you to brush your teeth for the front teeth. Okay, so, and this is just a picture of a patient who was using the Proxy brushes. So in the before picture, you see the gum is inflamed and it doesn't look too good. And they started using the Proxy brush in between that area to try to help clean that area, because floss wasn't properly getting that area. They weren't able to kind of massage the gums and help it back to health. So as you can see, 1 month, 4 months, you see that the gums now look even better. They look like they're even filling in that space there because of that Proxy brush that they were using. So if you're someone who has that type of situation where your back teeth, you're not able to get it properly with a floss, you can use those proxy brushes in between and get in there, and you'll start to feel a difference and see a difference as well. So then lastly, let's just say you haven't been able to take care of your teeth. Now you're at a point where you've lost a lot of teeth or you're losing teeth, and you want what options are out there for you. So that's what we're going to discuss: bridges, implants, and dentures. So one important thing that I want to mention is that I know many of you have had your teeth extracted in the past, and you've gone to a dental office complaining, and you just want to get the tooth out, and paying for other treatments might be too much. So you rather just take out the teeth. I understand sometimes finances come in the way, especially with dentistry. Some of our treatments are unaffordable, so you just want to remove the tooth, and sometimes the pain is so unbearable that you just want to get rid of the tooth. But one thing that's very important is that if you ever have to get your tooth extracted, you want to make sure that you get a bone graft, okay? Because the research says that when you get your tooth extracted, after a year, about 50% of the bone that's in that area reduces. So that means that the level that the bone was after you extracted the tooth has now reduced by 50%. So now in the future, if you want to get an implant, you have to even invest more money into your teeth, because now we have to do a bone graft first, then wait, and then also then get you the implant. So it makes the time frame to replace that tooth longer, because you have to go through more process, and then it also makes it even more expensive. So if you're ever getting a tooth extracted, always ask the dentist, will I get a bone graft? And see what they will say. Some dentists may not offer that option, but if you can, you make sure that you get maybe an oral surgeon or a periodontist to do the extraction. I'm biased, so I say to go to a periodontist to do your extraction, because the way we take care of the structure surrounding your tooth, the gum tissue, we make sure that there's no trauma that's being done to your teeth when we're doing extractions. Okay, so we make sure that the area is in a way where in the future, if you want to replace that tooth, is in a healthy position, you have enough bone structure there, and the gum tissue is nice and healthy for you to get an implant there in the future. So very important, if you're getting your tooth extracted, make sure you inquire, you ask about the option of a bone graft in that area. And then, so what are your options now that you've extracted your teeth? Maybe you got a bone graft, maybe you didn't. Now you're at the point where you want to replace that tooth. What are your options? So the two options are dental bridge or a dental implant. When it comes to these two options, the gold standard or the best option would be the implant, okay? So if you want to replace at least one single tooth, as you see here, the best option is for you to use an implant. But another option, which is usually more affordable and usually the insurance covers this, would be a dental bridge. And with this dental bridge is basically what we call a fixed restoration that replaces one or more teeth. And the missing tooth area will be replaced with an artificial teeth. So all these three teeth will be connected together, and then it will be holding on to whatever neighboring teeth that's there, your natural tooth or maybe an implant. So what is an implant? An implant is basically something that replaces the roots of your teeth. So it's a metal or something like a screw that is placed inside your bone, and it serves as the root of your teeth. Many people think, oh, they're like, oh, I just want an implant, but they don't know that the implant isn't the whole entire tooth. So the implant doesn't come with that crown or that white part that you see there where you bite down and you chew. The implant doesn't come with that. The implant is just simply that screw that's there that the crown is going to be placed on top of. So in this case, this patient is missing one front tooth there. So they place the implant there, and the implant has to heal for about 4 months. It has to fuse into your bone for about 4 months. And then after that 4-month period, they are able to place that crown on top of it. So normally the whole process to get an implant is about 6 months. So you place the implant there, and they won't just send you home with nothing there, especially if the missing tooth is in the front. They'll give you something that's temporary. And the temporary normally looks very nice, but it's not the permanent, but it still looks nice. And they'll give you that so you're not just walking around with no front tooth. And you wait for that 4-month period, and then we go back in again. After the implant has actually fused with your bone, we open up and we put another screw on top there, and that screw will give us access directly to the implant to place the crown. So that's why the process takes a little bit long, because you need a lot of time for your gums to heal and then also for your bone to heal around the implant. So in this picture here, maybe you're missing more than one tooth, and you don't have you don't want to disturb your natural teeth. So you don't want to shave down the natural teeth, and you just want to focus on the area that's missing. You can place 2 implants there, and then get the gums placed on top of those implants. And this is what we call the gold standard, because it's stable in your root. You won't find any problems with it, and it lasts for a very long time. So like I was saying, the pros and cons, or the benefits or the advantages and disadvantages of getting a bridge is that first, the benefits is that your insurance will cover, most insurance will cover for you to get the bridge. It doesn't require any bone graft, like I was saying, or any surgery. And then also when it comes to bridge, the disadvantage is that you may have to disturb neighboring teeth that are healthy. So let's say you are missing one tooth and you have 2 of your teeth that are next to it that are nice and healthy. We have to shave those teeth down to put crowns on there to support that artificial teeth that's in the center. So that's one of the things that's negative about bridges, is because once you disturb those teeth, now you put those teeth in a position where in the future they're going to have a problem, or they're bound to have a problem. So like it has written here, it has to be replaced every 5 to 7 years, because sometimes next thing you know, you have a cavity in that area, so you have to replace it. And then, like I said, it can damage healthy teeth around the missing tooth. When it comes to implants, you have longevity. You have at least 15 years or more, or a lifetime for you to have that implant. It's very natural looking, it's stable in your bone, and the success rate is at least 10 years of 97% success rate. The disadvantages of an implant is that insurance normally doesn't cover it. So you have to come out of pocket to pay for the insurance. Like I said, the process is long. It may take 6 months for you to finally get that tooth replaced. And you have to do surgery. And with surgery, there may be complications, especially let's say you're a diabetic patient, or you have some type of systemic condition that compromises your healing. Then you may find that the surgery option may be a negative for you. But all in all, the implant is the best option because it's stable, and you have a long lasting time when you have implants placed. Okay, so now let's just say you don't have any teeth. You've lost all your teeth, and there's many people who are in this situation where they've lost all their teeth. They've had to have all their teeth extracted. And then let's say maybe you are wearing a denture, right? But your denture is, every time you feel like, me kasa, you feel like, you feel like it's gonna come out, or wusra, and you feel uncomfortable because you feel like the denture is gonna come out, or maybe when you're eating, it feels uncomfortable. Then we have options where you can get implants. Sometimes 2 will be good enough, but 4 is the best. You can get 4 implants placed, and then your denture screws or snaps onto the implants. And now you can feel more comfortable when you're talking, eating, or smiling. You don't feel like the denture is just gonna fall out because it's snapped on to the implants that are in your bone. So you know it's sturdy and it's snapped on to the bone. So those are options. If you're currently wearing a full mouth denture and you feel like it's not stable, they say it's an ill-fitting denture, then you can inquire about getting implants to kind of help with that denture staying on. And then you don't have to worry about using the adhesive and all those things to kind of help the denture stay in. So just to go over all the options that I mentioned here. First, for single missing teeth, you have 3 options. You can get something that's removable. Maybe if you're a younger person, you don't want to use something that's removable, but you can use something removable for your missing teeth. And then you can get the bridge. Like I said, you have to shave down your healthy teeth, but that's an option if you have financial restrictions. And then also we have the implant, which is the gold standard. It's by itself. You're not bothering any other teeth, and you have at least 15 years or more to have that implant. If you are missing several teeth, again, you can use something that's removable. But one thing I want to mention with the removable denture is that sometimes the force can disturb the neighboring teeth. So I'll talk about that in a little bit, but you want to make sure that you don't just opt for something removable all the time only because of finances. Sometimes you have to, invest in your teeth as well. So again, missing teeth, you still can use bridge as well, or you can use implant to support that bridge if you don't want to disturb the neighboring teeth. And then again, if you have all missing teeth, you have the full mouth denture. And if your denture is not fitting like you want it to, you can use the implants to support the denture. Either you can use 2 or you can use 4. So lastly, I want to talk about, for those of you who are wearing dentures, what you can do as part of your nightly routine. And this also includes those who are wearing the partial. The partial is the one where you see here with the several missing teeth, the first picture, you have teeth there, but you still are using something else to replace the other missing teeth that you do have. You have to make sure that you remove your denture every night. I know that Abia, you didn't even say, what's that denture? So you feel uncomfortable, taking it out at nighttime, but you just have to do it because it is the best option for you, because it will prevent future bone loss in that area, because the partial dentures or the dentures, they apply a lot of pressure on your gums and the bone underneath it. So this pressure that is applying on there, it can cause future bone loss. And then sometimes because of that, you don't get the tight fit that you want. That's when it's like, oh, my denture is no longer fitting me properly anymore. It's coming out. Then you have the ill-fitting denture situation that I said. And now you have to always use the adhesive all the time just to make sure that the denture stays on. So you have to make sure you remove the denture. After you remove the denture, you clean the denture. Just because it's artificial teeth doesn't mean that it doesn't need to be cleaned. And I know those of you who do have dentures or anything removable at home, you know that it can get dirty. So you know that you have to make sure that you brush it all the time. Don't only brush it and put it back, but at nighttime, brush it, take it out. You clean your gums with the toothbrush. Just because there's no teeth doesn't mean you don't brush it. So you have to make sure you brush around your gums, you rinse it out, and then you put it in a container. Usually they give you a container that you can use it, or else you can use a glass or any container you want and clean it with the solution overnight. And then you allow your gums and your teeth to breathe. For those of you who wear partial dentures, which is not completely all fake teeth, it's just some of it is artificial teeth, it's very important that you do take out your partial at nighttime, because you don't want bacteria to keep on growing. You want your mouth to breathe at nighttime. So when you remove your denture at night, it stops that growth of that bacteria that's going on. Because when you have that bacteria under your partial that's applying all this pressure, the bacteria is still growing at nighttime. Maybe you didn't brush your teeth and bacteria is growing, you may find that you may have, you put yourself at risk of getting even a yeast infection in your mouth, and your gums will be inflamed, and it just starts feeling uncomfortable. Maybe some of you have experienced that with your partial, your denture, where your gums started to be very inflamed from wearing the denture, the partial of the denture all the time. You have to make sure you remove it so that your gums have time to breathe. And you remove it, clean your gums with your toothbrush, clean the denture itself, and soak it in the solution overnight. So to wrap up, with everything that I've said, most importantly, visit your dentist regularly. If you are someone who goes all the time, then 6 months is good for you. But if you're someone who has a chronic condition where you have this advanced form of the infection, you have to make sure that you go every 3 to 4 months. Insurance will cover some, and then you will pay for some of the cleaning. But in the long run, you've invested in yourself and you are healthy. You want to make sure you're brushing twice a day, flossing nightly, like I demonstrated to you. And then you want to make sure you're controlling your diabetes and all your other systemic conditions. But if you have diabetes, make sure that you are making sure that it's controlled. And that's pretty much about it. So thank you. I hope everything I discussed was clear and there was some understanding.
To serve there was CP, a one additional or the Amaye. You say, Ubia or lives to be at your CPA. So you see, you see here, apart from the head aspects, no, the Pacrano say, was seeing it a password crown, and I don't feel okay. The CP, a war additional or the Amaye. And you for the address, no, in some beside our door, with me up a Jawansa, our Zoom live, so. Mefro open so but type or question no about chat no so no see be hun akenkan na se bi kwa bia question no na ade a mpese obi abekan bia wetimi asende ama me na se bi asende ama doctor private message na ehun ni akenkan na answer question no sa penny ebeko no se de no no and next man sa in the pese bisa question no umi peja en santem after 9 no peja won sa e bia na mentimi amfro enti enye necessary to me abwa and yeah Mr. Osei Jabo opani Osei Jabo pejanensa opani me ma kwan ma do question no aba.
Okay, doctor, there was a na anka me were questions be but nam say I was say ye share ni equal intino reserve ba na later on no me na se chance be mu na me questions ni over here no. What I've seen is a lot of people no a scene very close. They don't want teeth gaps and temu. In the sometime crown wumutimi share be a sebea a bema wumo a very, very tight. You be saying me who free doctor was a scene a great edidemon. I say organ I say saying great the moya and anka but a has we opposite. Inti esia a grade demo no any dey very tight no dey hin na ye easily ya ebetime anya infection bi anase emu dey hin na ye dey grade demo na ye anase dey very tight no ena ena a follow up question bi so me dey ma one say as no matter what how many times I'll be brushing teeth no sometime no you will never get white teeth. Ibuana kwe bibi say light yellow bisa ube man 10 times a day krana still no that's what you're gonna get intino a sinner ye white pa no and only better ana said the aye a no ba kuno uya intiminya white no and also and no na a easy say and ubinya yare ana So what you see?
Yeah. So to answer the first question, between teeth that have spaces and then the teeth that have that are tightly next to each other, it actually really all depends, because if it has space in between, you have more chance of getting food stuck in between there. And then also the same time, when you have tight spaces, the food can still somehow, or plaque can still build in that area, because you're not able to properly remove it, because sometimes it's so tight that you can't even get the floss through it. So it just all depends. One isn't better than the other, but the whole idea is to make sure that you do whatever you can to clean in between the teeth. So if you have the large spaces, you want to use the brush, the proxy brushes that I mentioned. And then if you have the tight spaces, you're using the floss, but you're making sure you rub the floss against the tooth so that you can pick up and out the bacteria. And then to answer the second question, you mentioned about teeth color. Teeth color, no, it just all depends on the person themselves. Some people have naturally white teeth than others, and some people have more yellow teeth. Sometimes the food that we eat can cause your teeth to be more yellow, like palm oil and turmeric and curry, and those things can cause your teeth to be yellow. Or if you're someone that drinks tea or coffee, those things can cause your teeth to get more discolored. And then there's those who just naturally have white teeth. If you want your teeth to be more whiter, you can always go for the options of whitening your teeth, or using toothpaste that may have some whitening properties to it. But white teeth or yellow teeth, it doesn't really, there isn't one that's better than the other. It just all depends on how you want your teeth to look. Some people, they just like their teeth to be whatever yellow color it is, and some people like it to be very white.
All right, thank you. But Ima, I am say, minim so. Any part of do also, because more question keep to be an uncle their camera.
Yeah, but if I can help.
Okay. Doctor. Yeah, baby, now okay, say implant, you know. Don't think that the question is doesn't make no sense, but I have to ask. Who ye implanter? Yeah, well, it be a strong one. I find say on say Ghana for no. Kasebi or why na kono or say ubom naja and ka wo yi mu chimni ade no enti implant ni bi or why yes strong enough wa ubetimi e de abobo kasebi mu sa na say once I be implanted the kasebi wuntimi nge.
No, so that's the beauty around the implant, is that it's embedded in your bone. So ahordino is inside your bone. With the bridge, it's just floating, and the ahordino is being supported by just your natural teeth. So when you have the implant, it's embedded inside your bone, so you can live your life like how you normally live your life. And it's not gonna have any negative effects on you, because it's embedded in the bone, so it's very strong.
Oh, okay. Thank you.
When you say that was CP, Tim said, "We send beside who here pa a." Oh, doctor, I question back for chat or every say, yeah, sir. According to any opinion, you boy, yeah, say, we say braces, bet me up why cruise gaps now.
Yeah, so braces can definitely help close the gaps in between your teeth. Some people may benefit from just using Invisalign. Maybe gaps, no, it's not that many, and you can easily just use Invisalign. Or sometimes the way your head is shaped and your jaw is connected, you may need to do surgery. And in that case, you may actually need surgery and then also the braces. But braces is what will be used to close the gaps.
Doc, yeah, that was it. Then patch me free the DNA Fusiano Amano Aba.
Oh, Dr. Yamisha Mopao. Come as Bisane say, Yawa Ghana no, not Yanema be a woman, ne mano. Oh, no, breastfeed woman, only banner, no almost started air black. Say, I can say a shit. Almost say a new football why shit a say. It is person who says some of Fran, winning at a impact almost so. Say etutu na if no na does it have impact? Grown up no. It's 100% children. Maybe a woman na it makes me a cause harm. Man so one kasa so. They just me no. My dream why didn't na esme bi ohon mo aya na kasa de soro. Eno a nyame na ihye da ye ne sa. Me dream ho a menti ase so do e ho say bi mu de akasa piamba. Enyum. So a bad natural na said then because my mama na will be nansing who say wakwa ye we no ama wanya artificial we be ashe. Nti patron pese me hu sa my masim here.
Okay, so with the first question, your friend or baby bottle syndrome, and it's the same thing with breastfeeding. What happens is that when you're breastfeeding, you may breastfeed your baby and then you go to sleep. So then the bacteria from the milk and all that is sitting on their teeth, and then of course, because you haven't wiped it off, it's causing the bacteria to grow, and now it's sugar that is basically causing the cavity to occur on their teeth. So that's why their teeth turn to be black or because of the bacteria from the milk. So it's very important to make sure that if you're breastfeeding or if you're giving your baby a bottle at nighttime, that you make sure that you wipe their mouth when they go to sleep, so you don't get that cavity from happening. Because most of the time, kids, you're not brushing their teeth as much as you want to, but the best thing you can do is wipe their mouth when they're little and they're growing teeth, that you wipe their mouth after you give them breast milk or the bottle. And the effects that may have is that if you have that infection that's happening because the cavity has gone into the nerves, it can affect the teeth that are the adult teeth that are coming in. So sometimes people say, oh, and Cranston, so it doesn't matter, a bit tutu anyway. No, it can actually affect the adult teeth that are coming in. So you want to make sure that you take care of your little baby's teeth as much as you take care of your natural teeth. And I think it will have effect on their children. Not necessarily, but if you have an infection in your mouth and you always kiss your child on the mouth, that bacteria can also transfer to the baby as well. And then they can also, get their own periodontal disease from the bacteria that you transferred from always kissing or sharing, spoons and things like that. And then I think the other question I would say, and said, is it like a bimu or almost not painting? Is that what I think said? That's what you're trying to say? Yeah, that's just some people naturally, almost that's how it came in. So that's when you use the braces to kind of fix it and push it back so it can be nice and aligned with each other. Or sometimes that can also happen from periodontal disease, when the bacteria is eating away at the bone, the teeth is no longer being able to be held appropriately by the bone. So now it starts moving. So some people will find that it was straight before, but I feel that it's like shifting and moving. It's not straight anymore, and it's because it is either the periodontal disease that's occurring that is making their teeth shift. I hope that my answer question.
That's Matthias.
Mammy, so it was simple, sir. Opening yaw appear, opening partial with me, Cassa, open you appear.
Your dog, that's a brave. My question is, say, Hannah, I'm saying a simple woman, I say, a free a peer on a sideway, say, be a son of a range, I don't know, and on Quano, eyes have forcing away a peer. I say, a stick outside, and we say no, more say.
So for some people, you probably heard of the wisdom teeth or your third molars. Sometimes, when that teeth is coming in, it's pushing the other teeth forward. Your baby mesial migration. So sometimes, when that back teeth is coming, normally it comes between the ages of 17 and 25. But some people, it can be even way later. It just just genetics and how your growth is. But sometimes it could come way later. And when it's coming, it pushes your teeth forward. So I said, now is moving forward and it's no longer fitting. You have crowding of your teeth. It's like you don't have enough space for the tooth. And sometimes it's because of that wisdom teeth that came in. And then also sometimes, again, periodontal disease, your bone is being lost, reduced, and your teeth is trying to find its place. And that can cause your teeth shifting.
You are in sympathy and a banner son, see too. And I say, before I'm boy, able to me, I level on.
Yeah, so you don't have to get the tooth removed in that case. You just braces will be able to help that situation. And most of the time with the wisdom teeth, you don't need your wisdom teeth because you don't chew with your wisdom teeth. And it's hard for you to clean all the way back there. So most of my patients, I recommend for them to remove their wisdom teeth because they only cause more harm than any benefit. You don't use it to chew or do anything. So if you have wisdom teeth, it's best for you to just extract it. So you have that space to properly clean your teeth. But if that's happening to your teeth, you can just get braces, Invisalign, and it should be able to correct the situation.
Thank you so much.
Open here, was a question, Diaba. Will be sending me private question. You have me ready. Now, most a question about what's what chat nationally ready and also no one will do something. Question will be they're sending me one. Also now all about toothpaste no okay toothpaste bia to you the bia also now you use paste na wom fluoride wom man white patches e ba na so you catch and say enu ntie it also je use now they are back afa ho.
So when it comes to with the toothpaste, and that was what we call fluorosis, which is an excessive amount of the fluoride. Some people use too much of the toothpaste when they're brushing. So you want to make sure you just use a pea size, a small amount, because again, it's not how much toothpaste that you're using that's going to help brush your teeth. It's how you're using the toothbrush. And with the toothpaste, with the fluoride, and then also on top of that, in the water that comes from the faucet, most areas have fluoride already in it. So the combination of it may have caused you to get those white spots. So you can reduce the amount of fluoride that you're using. Maybe use a toothpaste, like a natural toothpaste that doesn't have any fluoride, and that's okay. It's okay. Or if you want, you can use a mouthwash that has fluoride. They have a mouthwash called ACT. It's like ACT in big letters. You can use that mouthwash every now and then, so you can at least still get some fluoride, but it's not something that you're using daily.
So it was it. You said what's it I see. Question back what chat no so na bakro e busa say rod canal a bit me negative effects or other teeth na so na things root canal here.
Okay, so when it comes to the root canal, the root canal is basically the nerves of your teeth may have gotten infected from the cavity that you had, and it got access to the nerves of your teeth, or what they call the pulp of your teeth. And it doesn't necessarily have an effect on the neighboring teeth, but if you have a cavity, that can also affect the neighboring teeth. So it's not necessarily the root canal, but it's more so the cavity that you have that will affect the neighboring teeth. I hope that answers the question. But if you have a cavity, you want to make sure that you take care of it before it turns into a situation where you do need to get a root canal treatment.
Is any panel at yes, yeah. Name a Fred Galaxy S10E, no. Now the question about.
Yo, Neima, me that's it. Doc, Yamisha and Pa, me question me, no. Me wadam phobia ne babe mabe like 8 years. But ne seno afi free home be brave. Eti bibi say no, at the end will be to me aye. My second question. Say, hope that will be a simoa. So will be to say, or mobe fele, dear hina ya a better.
Okay, so the first question, when the little kids are growing their teeth between the baby teeth and the adult teeth, sometimes it does look sad as sinaye bebre, but it's just because the things are happening in a specific time. In Tubenhu said, when the adult teeth comes, then the baby teeth will also be falling out, or sometimes they're there at the same time. So it makes it seem like that but it's really not. But sometimes some people know almost doesn't fall out at the time that you really want it to. So what in those cases, you want to make sure you go to your pediatric dentist. It's important that your children go to a pediatric dentist. The moment they have teeth in their mouth, you make sure that they go to the dentist so we can see that they're following the proper growth sequence, that their teeth are coming in at the right time, and then their teeth are also falling out at the right time. Because sometimes if things are happening before they're supposed to, or they're happening later than they're supposed to, it can also diagnose something else that's going on systemically. So you want to make sure that your children go to their pediatric dentist the moment they do have teeth. But in this case, I don't know how the child's teeth look, but most of the time with little kids, with their adult teeth and their baby teeth being coming and going, it may seem like it's so many teeth, but sometimes it's not really that many teeth. And I recommend you to go to your pediatric dentist to just make sure everything is going in the correct sequence. And then I forgot the second question.
The second question.
Oh, you said is if it's better to fill the teeth or to remove it.
Yeah, it's a whole no bows and that.
Yeah, depending on how big of a hole it is will determine the prognosis of the tooth. So we will say, yeah, the cavity is too big, so the tooth is hopeless, we have to remove it. Or the cavity is not that big, we can fill it, or we can do a root canal on the tooth and try to save the tooth by putting a crown on top of it. So it just all depends. But don't always rush to remove the tooth. You always want to keep your natural tooth for however long that you can. So if you have a cavity, try first to see if they can fill it. If they can't fill it, do the root canal. If they can't do the root canal and all hope is lost, then you consider extracting the tooth.
Dog, it was it. Oh, your question, me and Ebi Wahasi, I'm in Saka. And now, also, Bakosa Pian so in Suya Mefin panel. First question, the role of genetics in bone disease, like gum disease, genetics have a role in woman.
Yeah, so some people are more likely to get periodontal disease because they have a family history. So there's definitely a genetic aspect of it. So if maybe your mom had periodontal disease or your dad had it, then you are probably more likely to have it. But again, periodontal disease is completely preventable. So if you do your part, you can maintain your teeth and you won't have to deal with periodontal disease. But there is a genetic component to it, yeah.
Okay. The next question, what is the average cost of implant? And I have to take care of implant teeth.
Okay, so the average cost is a large range. It can be anywhere between 900 all the way to 3,000 or even more than 3,000. And maybe certain areas, maybe you can find it less than $1,000. But when it comes to implant, people have to understand that the implant, the screw itself, like I showed before, has one price, and then the crown that goes on top of it has another price. So the implant total cost, you may find that the implant itself is $1,000, and then the crown to put on top of it is another $1,000. So the price it varies based on where you go get it done, but the range can be between 1,000 to, let's say, 3,000 to 5,000 just to replace that one tooth. And then how do you take care of your implant? You take care of the implant the same way you take care of your natural teeth. They have something called Peri Implantitis, which is basically around the implant inflammation. And it's the same concept that what happens with your natural tooth. So if you have gum disease, we will never place an implant in a tooth that is having gum disease, because it will fail the same way your natural teeth fails with gum disease. So you have to make sure you're flossing and you're brushing around it. The same way you brush around your other teeth, you do the same thing with the implant, and you'll be able to get longevity out of it.
Dr. Edwase, you say the panel obsa question to you, what's here? When you appear, what's the sound? Say, man, I say old wine.
Old one.
Okay. Okay.
There's the one question
in the chat.
Yeah, in the chat. It says, how does the strength of the bristles on your brush affect your teeth? And does using a hard brush help your teeth or make matters worse in the long run? So with hard toothbrush, like I told you all earlier, if you have a hard toothbrush, you have to get rid of it because it makes things worse. It can cause gum recession because of how hard you're brushing, the gums can recede. And then also they have another thing called toothbrush abrasion or toothbrush abrasion. And those two things is basically because you've brushed so hard, you're removing that structure, or they call it enamel that's around the tooth, or the dentin that's around the tooth. And it's just breaking, and you see cracks in the roots of your tooth from how hard you're brushing. So if you already have an aggressive hand with brushing, and then on top of that, you're using a hard toothbrush, it can cause a lot of damage. So the best thing is to use a very soft toothbrush and brush gently.
Okay, Dr. Edwase. Well, question 3. The first one, we need to do answer. No, if Obusa say, sir, gum disease, okay, and one kakana. I mean, so we are no kaka.
Oh, so kaka is a cavity.
Yeah.
So it's not the same as gum disease. Gum disease is basically around your tooth. So it has nothing to actually really do with asinan kasa. It's just the gums and the bone that's holding on to the tooth. But kaka is basically a cavity.
Oh, okay.
Yeah.
Now, because they wouldn't kaka, and you know. Okay. And the next question, you know, was say, which now cut diabetes. Yeah, one of the cause of coffee yare eba. It is now no, so be diabetes yeah, dear now on advice about the man.
So if you have diabetes, the best thing you can do for yourself is to control the diabetes, making sure that you follow the recommendations from your primary care doctor, exercising and having a better diet. And then of course you want to avoid so much sweet foods, because that sweet food basically feeds the bacteria that's in your mouth and then cause the situation to be worse. And then of course, like I was mentioning before, the more you control your diabetes, the better you're able to control the inflammation that's going in your mouth, because the diabetes is also causing an inflammation in your system as well. So you don't want to have two inflammation going on in your body, fight both. So you try to control your diabetes, and that also helps you control your gum disease.
Okay. Now, last question, what I say, no, was say now, what's the implant, no? Now, okay, say, a bit me a last for 10 years. And you know, that means after 10 years, no, saying part of call for replacement, and answer after 10 years, no, say, and yeah, who you be also keeping the side.
Yeah, so with the implant, it lasts a very long time, and it doesn't have to be replaced after 10 years. If you are flossing and brushing your teeth appropriately, you'll find that you may have a lifelong time with the implant. But if you, if not, after 10 years, you may have to see about how you can take care of it. You don't have to completely remove the implant, but there's different things that we can do to maintain the health of the implant. We can do surgery, open up, clean out whatever bacteria that's on there, or there's just several different options for you. But the last resort wouldn't be to remove the implant, because there's longevity in the implant. So before you ever remove the implant, so that means that a lot of damage has occurred to that implant. It's no longer stable.
Okay, Dr. Edwase, I think say me need question be our happy. Na me who question be answer chat no so. Na me who so be answer apeja ne nsa ha. Gum gidi say and the addition the buy no. Ati ase pa nyame inshira na wonka ho na de oye bia no oma no enya nkoso na se de eti adesua no ye hu say even kwa say ye single problem we betim kwa hwe kwa betem emenya dementia antem edino dementia so de mi so bia ampe edino me gidi say enyina ye behwe ye sen eye na aboa ye na yetimi atrase ahoden mu me ma warren up kwa mu so be the one question bi abeka ho this answer my na fa summarize bibia emaye ene.
The question will say, if you have lost tooth but it does hurt, do you have to take it out? So if you've lost a tooth but it does hurt, I'm not sure. So if the tooth is there and it's hurting you, you don't necessarily have to take it out. You can get a root canal or they can do a filling. Maybe it's a filling that's causing the pain. Sometimes it's something very small that's causing the pain. The best thing is for you to go to the dentist. They will take an x-ray, and that x-ray will allow them to see what exactly is going on with the tooth that's causing the pain. And you don't have to rush to take out the tooth. You go through the different options that they recommend to you, and you pick what is best or what the doctor recommends for you. Yeah.
That's any over summarize bibia my na ewia ya bompae.
Oh, okay. So yeah, basically, no, you like I mentioned before, no, it's very important for you to take care of your oral health because it does have an effect with your systemic health. So you don't want to neglect your mouth at all. You want to make sure you're doing your part by going to the dentist all the time. You want to make sure you're brushing your teeth and you're flossing, and you want to make sure that you're going to your dental visits regularly. And if you have to spend money to invest in your teeth, don't, and money how, because at the long run it will help you, because if let's say you have a smaller situation and you didn't invest, you'll find that years later you have to invest even more money towards it. So the best thing is for you to do your part at home, and then also making sure you go to the professional to help you do the parts that you're not able to do.
Okay, that was CP and addition with the amaye. Na family na me so obi a woti na so no afane de nya behwe say be bit me atase ewo ahodin mu nyame nshira opi Dr. Salome Owusu-Frimpong ene yade addition no e ba wie no mesre ye sofo panyini ewo so Pastor IB ewo so pastor mesre na abompaye esre ne yesumi no so enyina amaye now the doctor so no asnya mensa amaye.
I'm sure my mom pie. Nananyame yada wase anyumre adisuya kese a wode adomoye. Wa ma yahunu hawa ebetimi aba yesen. Ye gums ye num na enye ye num kwa na be ha ye. Edi betimi anya effect ewa ye nipadua no health nyina so. Yada wase se Oba Salome nyansa ne nimdi a wode adom no wode nkyerɛkyerɛ te sɛ abrɛ na ɔtwe mu nyinara wahyira yɛn abedu sa abrɛ ɛno nti nsɛm a yɛtie yɛsrɛ sɛ ɔbɛboa yɛn na yɛde abɔ yɛn bra obiara a ɔwɔ problem na Awurade yɛsrɛ wɔ ma yɛntena ho ɛnɛma bi wɔ hɔ nom a yɛbɛtumi asia no a ɛho nhia so yɛde yɛn kotodwe bɛgu fam enti yɛsrɛ wɔ yɛne a yɛwɔ problems nyinara nea wakyerɛkyerɛ yɛyi ma yehu ye dentist dwumadie biara e wosi yedie efa enkyerɛkyerɛ ɔde ama yɛn sɛ de yɛbɛ brush your teeth number of times ni procedure ne kwan yɛbɛ fa so nneɛma a yɛbɛ use Awurade ne nyinara yɛsrɛw ma yɛnyɛ sitie ne yɛnyɛ ho adwuma na ɛma yɛn long life ɛfiri sɛ wasɛm a wɔde ama yɛn ne sɛ wɔbɔhyɛ ne sɛ ade nyinaa mu wopɛ sɛ si yɛn yie na yɛnya ahoɔden ti yɛsrɛw sɛ boa yɛn saa na hyɛ yɛn den yɛde wabɔfra Salome susu hyɛ wo nsa Awurade yɛsrɛw sɛ toa so na boa no na nimdie nyansa a wode ama no no watumi atoa so de bi aboa wo ma adwuma a wode ahyɛ ne nsa no so watumi abringi relief ama nipa bebra nya pains na yɛhu na mane eti yɛsrɛw hyira na adwuma so na hyira ne wɔyɛ so na nhyira wo hyira no ebi nka wasafo nyinara eti anwumre bra ye be free hanom akɔ yi yɛsrɛ wo sɛ awurade wobɛhwɛ yɛn so wobɛbɔ yɛn ho ban wobɛhyira yɛn anadwo yi wode wo nsa bɛto yɛn so na sade akyi anɔpa ne sɛ wonya ne yɛne a yɛn nyinaa bɛka bɔ mu ne yɛde aseda ayɛyie ne nkanfo abrɛ wo awurade enti anwumre yi nyame nhyira ne yɛde dom mu sɛ awurade nhyira yɛne yɛwɔ line so nyinara ɔnte n'anim nkyerɛ yɛn ɔmfa ne trene ne nkata yɛn so ɔnhwɛ yɛn anam nso ɔmfa yɛn nan yɛn kron ɔmma yɛn nnapa wɔ yesu din mu amen.
Amen. Pastor Dawase. The GD4 said, "But I make come, young upon board the same time." Yes, I remember. Young boy, you better Yakuma Wasem in Yabeka. When you see Yakuma, so the idea who here pa a Tion Bodin say, said in a buy no, as I ban sad young bochna, near bit see Yakuma who ensem. Yamin Sray on Kayaho, on pray and so, I bear home massem. No matter punching only dinimu. Amen.